One of the biggest challenges today in India that we have in healthcare is delivering quality healthcare to a billion Indians across a wide geography with limited resources in terms of infrastructure and skilled healthcare manpower. Now, while we are investing in creating more hospital infrastructure in both urban and rural, we are investing in more medical colleges, more nursing colleges to create a larger pool of skilled healthcare manpower in India. Technology can be one of the biggest force multipliers which can help us bridge this gap in a much shorter period of time and at a much less cost. Now, one of the areas where India can set a global standard in patient safety by leveraging cutting edge technology is by developing critical care capacities beyond ICU. Because if you look today also, there is a significant number of code blue events and adverse events happening outside ICU. Now, if you look at India, we have more than 2 million beds in India, hospital beds. Out of 2 million hospital beds, more than 1.5 lakh beds are ICU beds, where we have a nurse to patient ratio of 1:1 and the patients are continuously monitored. But outside ICU, we have almost 18.5 lakh beds where the patients are being monitored by the nurses by using spot checks manually. Now, when we have such a large pool of patients being monitored with spot check, it adds to a large amount of workload for our already stretched nursing teams. Another thing is it leads to possibilities of human error, and it also basically the biggest problem with spot check today is that with spot check we get limited amount of data, vitals data, and hence it fails to identify possible clinical deterioration much early, correct, leading to a compromised patient safety and clinical outcome possibility. Apart from this, today the hospitals are facing a big issue with a high churn in the nursing staff, because of which it becomes difficult to deliver a consistent quality of the service. Correct. Now, to address all these issues around the spot check and around manual monitoring of patient, imagine if we have a technology the way we have a Aadhaar card for every person in India, we have got a fast tag for every car in India. Similarly, can we imagine a technology where we have a simple sensor put on every hospital bed or every patient bed for that matter, whether it is hospital or home, which can enable us to do continuous monitoring and have early warning system for every patient. Now, this thing is much easier said than done. For that, we need a technology which is simple, which is scalable, and affordable. And that's what Dozee is all about. With Dozee, we put a simple contactless sensor sheet below the mattress of every hospital bed, and we can upgrade that bed into a connected bed in less than 5 minutes and at a fractional cost. Now, this is a transformational technology and have a large scale impact on the Indian healthcare system. Now, developing transformational technologies is one thing, but implementing them on ground at scale has different set of challenges. So what kind of strategies we need to apply to overcome these barriers? Now, one of the things that we have found is first working with large hospitals or big stakeholders or large players in the healthcare industry. Bigger hospitals need to work closely with the startups to ensure that innovative products are transformed into robust solutions which are scalable. At Dozee, we were very lucky to have support from big hospitals like Apollo, Bridge Candy, PD Hinduja, Vocard, and many more who helped us kind of co develop the entire solution. And today, the solution has matured and is adopted at a scale. Another thing which is important is change management. Now, when we want a large set of people to adopt a particular technology, there is always going to be some level of inertia. Correct. How do we overcome that? Hence, change management becomes very important. So, things like continuous training, correct? Things like knowledge transfer, onboarding key stakeholders, setting up SOPs, setting up protocols, correct? Setting up systems to track the impact of the innovation and much more. All these things are a part of the change management, and we need to work very closely with the team on the floor if we want the innovations to be adopted successfully. The third thing is investment in brand. When I say brand, the Indian startups or the Indian solution providers need to work or need to invest in things like getting international and Indian certifications, ensure that we invest in high quality clinical research, we have good real world evidences, and of course, invest in brand and marketing. Correct. This builds a lot of credibility around the innovation and is further instrumental to drive its adoption. Demystification of AI is very important. We keep hearing about AI. AI is the buzzword, correct? When you create a solution which has AI as one of the key components, it is very important that we demystify AI, especially for the healthcare providers. AI shouldn't look like a magic. We need to engage with doctors. We need to show them how the entire solution is developed, how the actual AI works, correct? What kind of clinical validation is there? Like, so demystification of AI becomes very important, and it would further help us to drive the adoption of these innovative solutions. Now, implementing an groundbreaking or a transformational innovation in healthcare is a time taking process. It takes a lot of energy, correct? And hence, a very high energy team is the core to drive the adoption of such an innovation. And above all, to keep us going for the long haul, it is very important that we are committed to the purpose behind the entire technology. And the purpose has to be nation building. Because we, as a country of 1.4 billion, when we solve a problem for our country, we don't solve it only for India, we solve it for the world. Correct? And that's the role we feel that India has to play in the larger global healthcare ecosystem. Solutions coming out of India, solutions which are made in India and adopted by the world. Correct? So, get in for a long game. Correct? So, yeah, I think thank you. Thank you very much.